COVID-19 terror in premature policy affects schools. Thoughts-rakyat.com. Thoughts of the people. What we have been worried about all this time, especially parents of students at various levels, has finally happened. There was a COVID-19 cluster at the school after face-to-face learning (PTM) was carried out. This was concluded referring to the statement of the Ministry of Education, Culture, Research and Higher Education Kemendikbudristek, which noted that there were 149 schools in West Java that became clusters of COVID-19 transmission during limited PTM. The data was obtained from a Kemendikbudristek survey of schools published Thursday, September 23, 2021. According to the source, this figure is equivalent to 2.25% of the total 6,616 schools in West Java that have filled out the survey. Read also, a week of limited PTM in West Bandung. The Education Office is not worried about the COVID-19 cluster. Schools became a cluster after 1,152 teachers and education staff and 2,478 students from a number of schools were infected with COVID-19. The highest percentage of COVID-19 clusters occurred at the high school SM8 level, which was 4.66% or 16 schools out of 343 schools. At the level of early childhood education PAUD, there are 29 schools or 1.89%. At the elementary school SD level, there are 61 schools or 2.14%. Clusters at the junior high school SMP level are 24 schools or the equivalent of 2.15%. In vocational high schools SMK there are 9 schools or 1.72%. In special schools SLB there are 2 schools or 2.06%. Also read, West Java Education Office makes sure there are no PTM clusters in West Java, if they are ready to be closed. However, this has been denied by the West Java provincial government. Head of the West Java Education Office, Dedi Supandi, confirmed that there were no COVID-19 clusters in schools that held PTM. He mentioned this after conducting an investigation through the network and supervisors at the branches of the Regional Education Office. In fact, he said that there had been a communication misunderstanding. The Governor of West Java, Ridwan Kamil, also provided clarification regarding the findings of school clusters by the Ministry of Education and Culture. Via his social media account, Ridwan said that no school COVID-19 cluster had been found during the PTM. Ridwan Kamil included a definition of cluster which was also clarified by the Ministry of Education and Culture. Although the data has not been confirmed to be correct, this is a warning alarm for all parties that COVID-19 is still there and the cases could increase again if we are not vigilant. Also read, Ridwan Kamil denies 150 school clusters in West Java. Kemendikbud findings, what happens is, especially if the vaccination program has not touched children. That's what we have to watch out for. There is a joke in society that says that the vaccinated children are aged 12 to 17 years. However, why are PAUD to elementary school students also allowed to go to school even though PTM is limited? In fact, vaccination for children under the age of 12 is still in the study stage. The transmission of the COVID-19 virus to children is increasingly worrying. Data from the COVID-19 Handling Task Force on July 16, 2021, noted that 12.8% or approximately 351,336 positive cases of COVID-19 occurred in children aged 0 to 18 years. Child victims who died reached 777 people. The highest percentage of mortality was in the 0 to 2 year age group, followed by the 16 to 18 year age group, and the 3 to 6 year age group. There are 5 provinces with the highest number of child cases of COVID-19, namely Jakarta, West Java, East Java, Central Java and Yogyakarta. Similar data was also presented by the General Chairperson of the Indonesian Pediatrician Association IDAI Professor Dr. Saif Bhakti Pulingan. National data shows confirmation of COVID-19 in children aged 0 to 18 years has reached 12.5%. This means that 1 in 8 confirmed cases of COVID-19 are children. IDAI data also shows that the case mortality death rate reaches 3 to 5%. So, Indonesia has the highest death rate in the world. Save the Children's Global Survey in 2020 in 46 countries including Indonesia showed that the hidden impact of the pandemic has been felt directly by children. In addition, children experience more domestic violence and face 3 times the risk of violence than before the pandemic. COVID-19 on children is also a concern in developed countries. On the 23rd of September 2021, the UK government's senior health affairs advisor Chris Whitty said the current highest transmission of COVID-19 was in children aged 12 to 15 years, school-aged children. He said almost all children who were not vaccinated would become infected. So, schools will not be opened unless the children have received the vaccine injection. This is different from the conditions in Indonesia, which impose schools even though PTM is limited, even though many students have not been vaccinated.